Baruch Hashem, we are continuing our discussions of Shabbos and somebody who is sick from Rabbi Appel's book, Rahmana Litzlan. So internal injuries, for example, an infection, any infection at any part of the body that's internal is treated as a life-threatening illness. So if God forbid someone is wounded on Shabbos, every precaution has to be taken to make sure that the person's health, even if it involves violating Shabbos, is must be priority. Any injury, wound, or abscess which is found from the lips inward, including the teeth, is an internal injury, and you violate Shabbos for it. You don't even need to assess the illness in that case. It's automatically treated something you violate the Shabbos. However, if the nature of the illness is known and you can see that the patient's condition, that the treatment for the illness can be deferred and there's no need to violate Shabbos, then don't violate it. So if someone has a severe toothache and suffers from it to such an extent that the whole body is incapacitated, the person is permitted to ask a non-Jew to pull the tooth. Let's look at the footnote. Someone who has a severe toothache may apply medication on Shabbos. If there is a severe pain in the tooth or swelling of the gums, or there's a possible infection or dental abscess, then it's obviously life-threatening. Chazal considered a blow on the back surface of the hand or on the upper side of the foot to be like an internal wound, usually resulting in swelling and possibly affecting the areas and blood vessels. For these injuries and other conditions which they considered life-threatening, Shabbos is violated regardless of medical opinion on the matter. Chazal are the authority in matters of halacha, and this is a matter of halacha notwithstanding its medical implications. So the following are cases in which Shabbos is violated. A wound on the back of the hand or on the front of the foot. B, a wound caused by a metal object. C, an ulcer at the opening of the rectum. And D, someone with a very high fever, but not for an ordinary fever. What about resetting a dislocated limb? It's permitted on Shabbos to treat a break or fracture and to reset the limb, whether it's broken or not. When a limb is endangered, it's considered to be life-threatening and Shabbos is desecrated. Okay, what about hemorrhoids? Someone who suffers from hemorrhoids, chas v'sholom, may use suppositories on Shabbos and bathe the area in warm water if it was prepared in a permissible manner. Okay, fine. And I'm normally a high fever. A fever accompanied by chills is considered life-threatening. But if it's just a regular fever, you can't violate the Shabbos. It's just due to a cold. Shabbos is violated for someone who feels pain in the eyes or has pus in the eye, or if there's a discharge or bleeding from the eye. If a patient who is ill requires food for strength, but the only food available is not kosher, it's permissible to violate Shabbos to bring kosher food to the patient. Of course, it is critical that the patient eat right away. If it is critical that the patient eat right away, he or she should be served whatever is available. So you can violate the Shabbos to bring kosher food to the patient rather than giving the patient non-kosher food. But if the patient needs to eat right away, then give him even the non-kosher food. But if the patient can wait, then you should get kosher food, even if they'll have to violate Shabbos to prepare it. So why do you have to violate Shabbos to prepare kosher food even when non-kosher food is available? Two reasons. One is that once violating Shabbos is allowed for the sick person, halacha does not consider serving non-kosher food a viable option if the patient can wait for it. This is a really, really fascinating halacha, that you're better off violating the Shabbos to prepare non-kosher food than giving to prepare kosher food than giving non-kosher food to the patient. The second reason is that we're afraid that the patient's realization that he or she ate forbidden food may cause even more sickness. According to the second explanation, we permit to allow a child to eat the non-kosher food, since the child would not be aware of the source of the food and not react that way. Wow. So we give the patient kosher food even by violating the Shabbos, because if the patient realized they were eating non-kosher food, they'd be so adversely affected by it. But what about the fact that they realize that they're violating Shabbos on behalf of the patient? That wouldn't affect them as much. This is deep. If the malacha is violated on behalf of a dangerously ill patient, the results of that malacha may not be used for the benefit of a healthy person. Immediately after Shabbos, however, it may be used. For example, if food is cooked for a patient, a healthy person may eat it immediately after Shabbos, but not before. If someone else is being forced to transgress one of the mitzvahs of the Torah, including Shabbos, on a one-time basis, you may not desecrate Shabbos to spare the first Jew from the transgression. However, if a Jew, whether an adult or child, is being forced to convert from the Jewish faith, Rahmana litzlan, to abandon Klal Yisrael, everyone is obligated to exert every effort to save him or her, even if it requires desecrating a malacha from the Torah. Just as we're obligated to desecrate Shabbos for a dangerously ill person. Because it says in Torah, the children of Israel shall keep the Shabbos. Chazal explained, desecrate one Shabbos on account they may keep many. So you are obliged to desecrate the Shabbos and do whatever you can to save one Jew from being lost to Torah mitzvos, even if it's doubtful whether your efforts will avail, just as you may desecrate Shabbos even in the case of a doubtful danger to human life. There's also a fascinating halacha. So here you can violate the Shabbos to save a person from converting to another faith. However, for someone who willfully wishes to forsake the faith, the Jewish faith, you're not permitted to desecrate Shabbos when it involves violating a Torah prohibition. When someone rejects the faith willfully, we do not say to another person, sin so that your fellow may benefit. Nevertheless, when it only involves violation of rabbinic prohibition, and such as going beyond the Shabbos limit, riding on a horse or in a wagon or handling money, some permit violating Shabbos in order to save a fellow Jew. Okay, so now we're up to the next chapter, laws concerning a woman in childbirth. You know what? We haven't skipped any chapters yet, so we won't skip this one either. But the truth is, when she's in labor, go. Well, let's see what they say. As soon as a woman begins to experience signs of labor, even if she's not certain of it, you should summon a doctor immediately, even from a place many miles distant. Preparing for possible delivery of the baby on Shabbos. The woman is in the 9th month. You should consider and prepare for the possibility of her giving birth on Shabbos. Preparations you should make include packing a bag, arranging for babysitting, setting aside an envelope with car fare, arranging for transportation, so that there will be minimal desecration of Shabbos in the event she goes into labor. She need not, however, trouble herself to stay near the hospital so as to avoid traveling on Shabbos. Calling a woman's own doctor. You're permitted to call a woman's own doctor to attend to her on Shabbos and to deliver the baby, even though it involves violating Shabbos. There's another doctor readily available. Halacha requires that everything be done for the sake of a woman who's in labor to ease her anxiety. Transporting a woman in labor to the hospital. At the first signs of labor, you should call a car service or an ambulance, or drive the woman to the hospital, as in the case of a person who is critically ill. If possible, and there's no undue delay, it's preferable to call a cab or a car service rather than drive on Shabbos. She may be driven to her designated hospital, so that her physician will deliver the baby, even though there's another hospital nearby or closer. The woman may be accompanied by her husband or by someone else in order to comfort her, and she may take along whatever she will need on Shabbos. Although childbirth is a natural function, women in childbirth are considered to be in the category of dangerously ill, and Shabbos is desecrated on her account for whatever she needs. Yeah, yeah. Did you put not the warmer? Don't you see it's on, Omar? Don't you see the red light on and hear it? Yeah, yeah. So you put it in? So smart. Thank you. Thank you.
We got pizza and we
Uh,
got cheap on that.
what?
This time is cheaper than that.
Okay, okay, okay. Good, good, good. All right, we'll stop the laws of Shabbos and go on to the Rashi. Beautiful. Baruch Hashem. Thank you.